Before you take your next calcium supplement, there's something you need to know about vitamin K2. I'm Dr. Williams Foster, and after 24 years in medicine, I want to share what recent research reveals about 4 commonly taken supplements after age 65, including findings that surprised even me. If you're taking a daily multivitamin or calcium supplement, the latest studies suggest you might want to have a conversation with your doctor. This isn't about what to avoid. It's about equipping yourself with the right information. So what is the best decision to make concerning your health and well-being? The core problem. Here's what's emerging in nutritional research. Supplements don't interact with aging bodies the same way they do with younger ones. After 65, kidney function naturally declines by about 30 to 40%. Liver metabolism changes. Medications interact differently. What worked at 40 may need adjustment at 70. I want to introduce you to a concept I discuss with my patients called nutrient balance. When we take multiple supplements without coordination, they can compete for absorption, affect how medications work, and sometimes accumulate in ways that create imbalances. This happens gradually, which is why it's rarely connected back to supplementation. Let me walk you through what current research is revealing about 4 supplements, and more importantly, what evidence-based alternatives you might discuss with your healthcare provider. And if you find this helpful, go ahead and subscribe. I share research-based insights like this every week to help you make informed health decisions. Supplement. Number 1. Calcium without cofactors. Calcium supplementation has been recommended for decades for bone health. But emerging research is prompting important questions about how we use it, especially after age 65. A 2019 study published in the Annals of Internal Medicine followed over 388,000 adults and found something unexpected. Those taking high-dose calcium supplements without vitamin K2 had markers suggesting increased arterial calcification. The researchers noted that calcium needs cofactors, particularly vitamin K2 and magnesium, to be directed to bones rather than soft tissues. This doesn't mean calcium is harmful. It means the way we've been supplementing may need refinement. Think of vitamin K2 as a traffic director. It activates proteins that guide calcium to your bones and away from your arteries. Without it, calcium supplementation may not achieve its intended purpose. A patient I worked with started calcium supplementation at 72 for osteoporosis prevention. Her bone density showed minimal improvement over 2 years, but a coronary calcium scan revealed concerning arterial calcification. When we added K2 and switched to food-based calcium sources, her follow-up markers improved. Evidence-based alternatives to discuss with your doctor. Emphasize calcium-rich foods, leafy greens, sardines with bones, fortified plant milks, yogurt. If supplementing, consider no more than 500 milligrams with cofactors like K2, magnesium, and vitamin D. Weight-bearing exercise. Research consistently shows resistance training and walking stimulate bone formation more effectively than supplementation alone. Ask your doctor about a coronary calcium scan if you've been taking high-dose calcium long-term. If you're currently taking calcium supplements, drop a comment below and let me know if you're also taking K2. I'm curious how many people know about this connection. Supplement number 2. Iron without testing. Iron supplementation is another area where current research suggests we need a more personalized approach, especially for older adults. After menopause and throughout older adulthood, iron levels naturally stabilize or rise. The body retains iron more efficiently, yet many people supplement without knowing their levels. A 2017 study in the Journal of the American Geriatric Society found that elevated ferritin levels, indicating iron storage, were associated with increased oxidative stress and inflammatory markers in older adults. Iron is chemically active and can promote free radical formation when present in excess. The concern isn't iron itself, it's unnecessary iron supplementation. I've worked with patients who were supplementing iron for fatigue without testing. When we checked ferritin levels, several had elevated stores. After discontinuing supplementation and addressing actual causes of fatigue, often B12 deficiency, thyroid issues, or sleep apnea, their energy improved. What research suggests? Get ferritin tested before supplementing iron, not just hemoglobin. If you're not anemic, iron supplementation typically isn't indicated. If you are anemic, work with your doctor to identify the cause and supplement appropriately. Food sources of iron like lean meats, beans, and spinach come with natural regulators that prevent overload. Supplement number 3. High-dose vitamin E. Vitamin E was once heavily promoted for cardiovascular and cognitive health, but large-scale trials have prompted a significant reevaluation. The HOPE trial, published in the New England Journal of Medicine, followed over 9,000 patients taking 400 international units of vitamin E daily. Researchers found no cardiovascular benefit and noted increased rates of heart failure in the supplementation group. Similarly, the SELECT trial studying prostate cancer prevention found higher cancer rates in men taking 400 international units of vitamin E daily. Why would an antioxidant show these results? Researchers proposed that high-dose synthetic alpha-tocopherol, the form in most supplements, may displace other beneficial forms of vitamin E, creating an imbalance. There are 8 natural forms of vitamin E, and isolated supplementation with just one may disrupt this balance. Additionally, vitamin E has blood-thinning properties that may compound effects of medications like aspirin or warfarin. What the evidence currently supports: obtaining vitamin E from whole foods, almonds, sunflower seeds, spinach, and avocados provide all 8 natural forms in balanced ratios. If supplementing, discussing with your doctor whether mixed tocopherol formulas under 200 international units might be more appropriate than high-dose alpha-tocopherol. Reviewing all supplements with your doctor if you're on blood-thinning medications. Quick question for you: are you taking vitamin E supplements right now? If so, do you know which form you're taking? Let me know in the comments, and if this video is giving you new insights, hit that like button so I know this type of content is helpful. Supplement number 4. Multivitamins. Multivitamins seem like a safety net. Comprehensive nutrition in one pill. But recent research suggests they may not provide the benefits we assumed. The Iowa Women's Health Study, which followed over 38,000 women for 19 years, found that regular multivitamin use was associated with slightly higher mortality rates compared to non-users. The Physicians' Health Study, too, found no significant benefits for cardiovascular disease or cancer prevention from daily multivitamin use. Why might this be? Several theories. Multivitamins provide nutrients in forms and ratios that may not match individual needs. They may include nutrients you don't need, like iron for older adults, while underdosing others. They can create a health halo effect, where people feel covered nutritionally and pay less attention to diet quality. The concern isn't vitamins themselves, it's the one-size-fits-all approach. Research-supported alternative approach. Get blood work to identify actual deficiencies. Vitamin D and B12 are most common in older adults. Consider targeted supplementation based on testing, not assumption. Prioritize nutrient density from whole foods. They contain thousands of beneficial compounds that no multivitamin can replicate. If you choose a multivitamin, discuss with your doctor whether a senior-specific formula without iron might be more appropriate. What the research pattern shows. Looking across these studies, a pattern emerges. More isn't necessarily better, and isolated nutrients don't behave the same way as nutrients in food. Your body at 70 has different needs than at 30. It requires precision, the right nutrients in appropriate forms, at levels matched to your individual status. What research consistently shows matters most after 65: regular physical activity, nutrient-dense whole foods, quality sleep, social engagement, and stress management. These lifestyle factors have stronger evidence for longevity and health span than any supplement regimen. Based on current research, here's what to discuss with your healthcare provider. 1. Request testing before supplementing. A comprehensive metabolic panel can reveal your vitamin D, B12, iron, and magnesium status. This allows for targeted, personalized supplementation rather than guesswork. 2. Emphasize food-based nutrition. Whole foods provide nutrients with natural cofactors that enhance absorption and utilization. Colorful vegetables, fatty fish, nuts, seeds, legumes, and whole grains offer nutrition that supplements can't fully replicate. 3. If supplementing, be strategic. Research most consistently supports vitamin D supplementation for older adults with deficiency. B12 for those with absorption issues, and omega-3s for those who don't eat fish. Discuss with your doctor whether these apply to your situation. 4. Review your complete regimen. Bring all supplements and medications to your doctor to review for interactions, redundancies, and appropriateness for your current health status. 5. Invest in lifestyle fundamentals. The strongest evidence for healthy aging comes from resistance training, cardiovascular exercise, adequate protein intake, social connection, and cognitive engagement. You're the decision maker for your health, working in partnership with your healthcare team. The more informed you are about current research, the better conversations you can have. If this information was valuable, do me a favor and share it with someone who might benefit from it. And I'm really curious about your experience. What supplements are you currently taking, and has your doctor reviewed them recently? Share in the comments below. I read every single one, and honestly, I learned just as much from your experiences as you might learn from these videos. I'm Dr. Williams Foster with Senior Health Tips. Remember, the best health decision is an informed one made in partnership with your healthcare provider. Stay curious, ask questions, and prioritize what the evidence actually supports. If you haven't subscribed yet, now's a great time. Just click that button below. I'll see you in the next video. Take care of yourselves.